Good morning, and welcome to part 3 of our eye gaze series, from evaluation to treatment. And today we will be focusing on eye gaze treatment plan. And before we begin, I would just like to know, what is your primary role? So just tell me about yourself, who's in attendance. Please start clicking away and you'll be able to see who is on the call as well. I see we have some OTs and SLPs. While you guys are letting me know who you are, my name is Rachell and I am a speech-language pathologist and working with eye gaze devices and communication devices for quite some time now, specializing in eye gaze evaluations with adults with ALS and pediatric eye gaze evaluations. So thank you all for joining. I'm going to skip to results and see who all is here. Thank you. So now we also, again, this is part 3, so I would love to know if you were able to attend the last session, which was on the evaluation report when you're submitting for that device. So please let me know if you were able to attend last time. Okay. All right, so just a few of you attended last time, and a lot of you didn't, which is good that we're going to just do a very brief review because it really all ties together. Again, this is part 3, and we want it to all kind of flow together. So we're just going to go over briefly the highlights of last time. So we were talking about that report writing, the challenges when you're ruling in and out eye gaze accessories. Is sometimes we put too much information, which means we're adding information that's not necessary to the funding of the device. Sometimes we have not enough info, meaning we're leaving out pertinent information to funding that eye gaze accessory. And the last thing that we talked about last time was conflicting information, which means contradictory statements within your report, which also could delay your student or patient getting their device if our report is kind of thrown out for one of those reasons. One thing that we did not, or I don't think I stressed enough last time, is that conflicting information can also happen on the part of your physician. So the notes that you have to get for some funding sources require face-to-face notes. That could have something in it that contradicts something that you put in your report. For instance, your physician might not have described the person's impairment as severe, whereas for eye gaze funding, for most funding sources, you have to use the word severe. So if you use severe and your physician did not, that could be considered conflicting information. Continuing on with our review, remember that our funding report has some important components to it, but prior to writing it, we want to make sure we have that complete history. It includes home health, community, and education. Remember that you want to know the rules of your funding source, and if your DME or medical equipment provider, that's the entity you're submitting your report to, if they have any guidelines or rules, you want to make sure you're following those. Make sure you get a complete packet from them. Each DME provider or entity has their own packet of funding or maybe their own process. So make sure you have that prior to writing your and submitting for funding. And make sure that your evaluation is very thorough and you're documenting very, very well. That's going to help you, especially if you're keeping good records. Keep stellar records, even if you don't think it's something matters, still take note of it, because it may be important to ruling in or out this particular eye gaze accessories that you are attempting to do. The largest area of importance for documenting when it's an eye gaze accessory or device, remember that you have to say why other access methods do not work. It's not simply enough to just list them and say, I chose this one. You have to talk about why they didn't work, why you didn't go with something that was less expensive as the eye gaze options are. It's okay to be repetitive within your report as long as you are consistent. So please remember that. You have to be consistent when you're being repetitive. It's okay to say over and over again and throughout your report that this person has this disorder, or this person cannot do this physical action because of this reason, as long as you are consistent in that documentation. Remember, the components of the funding report do not have to be in any particular order, but they should include your communication impairment, describing it. Remember, for eye gaze to be funded as an accessory, you do need to talk about some severe needs. Also, just in general, for a communication device to be funded, most funding sources want to know that the communication impairment is severe. So that's not just related to eye gaze. Don't forget to talk about your prognosis. That's your anticipated course of impairment, stable or declining. That's really important when talking about funding an eye gaze accessory. They want to know that this person is going to be using that eye gaze accessory for the foreseeable future, and that you're not funding something that's temporarily, that they're going to need it for the foreseeable future. Comprehensive assessment. Don't forget that you have to comment on vision, hearing, and physical status. This is important when thinking about eye gaze accessories, because you have to note whether or not the person needs any modification related to that eye gaze accessory, or some funding sources may want you to say that with the modification of eye gaze, that is what causes the person to be successful communicator. So just be mindful of that. Language cognition, remember that you can use standardized testing, but you can also use your clinical observations. Remember to document on all of their daily functional communication needs, considering all their partners in their environment. This is going to be really important to your treatment plan, which we are going to be discussing at large today. Your rationale is very important to have in that report, because you have to state why you're ruling other devices out, what devices you tried. You have to state that this SGD, the speech-generating device that you chose, along with the eye gaze accessory, is the best method for communication, and tell why. Now, when you're listing out your recommendations for the eye gaze accessory along with that communication device, it's very important to remember this. And I'm going over it again because I'm not sure if we stressed it enough last time, that your recommendations need to be listed separately. This is important because your accessories, which would be your eye gaze and your device and your mount, those have to be on separate lines. And this particular slide we got from a webinar with Toby Dynavox, which was a really good webinar, and is also posted in the reference section. So if you are getting a copy of this PowerPoint later, you would click on that Toby Dynavox reference if you want to view their recorded webinar on report. But this particular slide, I think, is just really important, something that we often forget, that when you are funding for an eye gaze accessory, even if that accessory looks like it is attached to the device, it's not separate from the device to your naked eye, it still is separate when it comes to funding. So a funding source wants that written separately. So you cannot say, I'm recommending a PRC Accent 1400 with the new eye accessory, or a Dynavox, Tobii Dynavox I-15 with eye gaze. You have to use the word "and." It has to be on a separate line, even though you're thinking of the two things working together. So please let me know if you have any questions. You can type your questions throughout the session today, and I will make sure that before the end of it we answer them all. So you've done that report. You've done your stellar evaluation over multiple sessions. You have great documentation. You have completed your funding packet, and you have all the components for a successful rationale. You ruled things out. Your report is stellar, and you are done, right? Well, no. You're missing something very vital, and that is your treatment plan and your functional goals. And that's really important not only to your device users' success and independence eventually with using this device, it's important for funding because it's a key part of your funding report. So I want to ask a question. Can your device submission report be red flagged or denied by your DME provider, that's the entity you're submitting your report to? Can it be denied because of something in your treatment plan? And thank you all for submitting your answers. So largely, we are getting lots of yeses. And you're right. Your report can be thrown out, or you can be asked to correct it because it's something that you either forgot to write or didn't write, or something you did write in that treatment plan. Some of the reasons could be you forgot to add your goals. Long-term and short-term goals are both needed. Another example is maybe your frequency of treatment doesn't match your long-term goal. So, for example, you may have a short-term goal of someone being able to achieve something within 6 months of you using the device, but your long-term goal is for 3 months. That doesn't add up. So even little mistakes like that can cause a problem when submitting your report for the SGD and eye gaze accessory. You could also have goals that are incomplete or inconsistent with your data from your report. For example, let's say your student is working on being able to combine two word phrases, and in your report, you're documenting how well they were able to do that with the device. But then in your treatment plan part of your report, you have that goal as something you want them to accomplish. That does not add up. And yes, you think, well, are they really going to pay attention to that level of detail? Some funding sources, yes, and you don't want it to be thrown out later either. So just be very careful when you're writing your treatment plans, making sure that it is in line with your report, but also that you're making something that's more than just a couple of simple goals. If you write a really great treatment plan, something that you're actually going to use in therapy, it's going to be better for the person that you're working with, right? So your treatment plan has to have some functional communication goals for the end user, the device user. You're going to be considering their current communication partners or who they want to communicate with, their environment. You're going to be considering their current level of communication, long-term versus short-term goals. Remember to consider that they're using an eye gaze accessory while planning your goals. A lot of times we might have, if you're in a school, you might have a goal bank with your IEP. And so sometimes when you're dealing with goals like that, the eye gaze accessory really isn't considered in the writing of those. So if you're using a bank of goals, remember that not to forget about that eye gaze accessory and to change the wording accordingly. You must state frequency of treatment with the device with the SLP. As we talked about in earlier part 1 and part 2, these evaluations for eye gaze or any other communication device for that matter, sometimes it's a team effort, right? You have speech, you have OT, you have PT. So sometimes we forget that that treatment plan only relates to the speech-language pathologist, what your therapy goals are for the sessions with your SLP. Additionally, some funding sources may require you to state what your timeline is for reassessment, or who is the responsible party for programming and troubleshooting, or the type of therapy you're going to use, group versus individual. Sometimes it's your state Medicare, Medicaid. Sometimes it's your state Medicaid rules that may require some of these extra statements. Remember, every state's Medicaid is different, and the requirements for that funding report may be different based on where you live. With Medicare, again, every region is different. So I may be in a different region than, let's say, New York. So the requirements will be different. So just make sure you know if your funding source has any special requirements when it comes to the treatment plan. Asking the entity that you turn your report into is probably a good place to start for any particular rule. But most of the time, the treatment plan just is your functional communication goals, long-term and short, making sure your dates are in line and consistent. So I want to know if anyone is familiar with the dynamic AAC goals grid, or sometimes abbreviated as DAG. And if you've used it before or you know what it is, thank you for your responses. So it looks like largely we are unfamiliar with it, which is good, because we're going to kind of go over this tool in detail today, and then there is a link to this tool in the PowerPoint, but when you receive your email after the session today, we'll be sure to include that link for any of you who want to print it out. Let's talk about it. So the dynamic AC goals grid is something that I love because evaluators can use it. Really, you can use it with any device. It's not made for an eye gaze user particularly, but it's a really good tool. It's a really good tool for evaluations treatment. So you can actually start filling this out for patients or students or client right at the beginning, and it's going to help you with your evaluation, with reassessing, and with goals. It examines each functional area of language when it comes to communicating, and it's easily adaptable to multiple devices and language systems. So even though Dynavox had a part in putting this tool together, and they adapted it from some researchers, it doesn't just work with Dynavox systems or just one type of language system. So it doesn't matter what language system you're using. I could use this with someone with Unity or Essence on a PRC, or I could use it with Communicator 5 or Compass on a Tobii Dynavox. So that doesn't matter, which makes it a great tool. Easily adaptable to using it with eye gaze accessory user. And it doesn't matter if the person is a student, a small child, or an adult. Very easy to adapt it. Okay, so let's take a look. The competency areas are your linguistic, your social, your operational, and your strategic. And then you have ability levels that kind of match each competency area. So someone could be emergent in their social, but they might be context dependent in their linguistic. So your ability levels are emergent, transitional, context dependent, transitional, independent, and independent user or ability. So we'll talk more about these, and we're actually going to look at some examples today. So here is just an example of one summary level, and so as you are using this with the person, you can check off where you think they are for each skill level, and you can also write notes. So very easy to use tool, really nothing hard to understand about that. So we're going to watch a quick video, and for those of you who were able to join for the very first session, we talked about Emily a little bit in that session. So we're going to be using her as an example. We're going to watch a very quick video about her experience, or her first experience with an eye gaze device. Okay, so hopefully everyone is able to see my screen.
Yes, we can.
And I'm going to, 1 second, unmute it so that you guys will be able to hear my video. All right. Sorry about that. Here we go.
Rachell, can you turn that volume up a little bit?
With her
Okay, so I'm not sure if everyone was able to hear the entire video, so I will just kind of review what was said. So Emily had Rett syndrome, and she had never used an eye gaze device before, and we put it in front of her. We did not calibrate her to the device. We wanted to see what she could do, and immediately she was able to use it to color on a whiteboard. And in conversation, we happened to mention, that we didn't like this color. We didn't like light blue. We like dark blue. So that's just in conversation, like a comment, not really directed to her. But based on that conversation, she was able to change her color to dark blue. And so that's really when I think teachers and everyone in the room realized, well, wait a minute, she really is understanding everything that you're saying. And so this is how we would have used the DAG with her. So for linguistic competency, she was already communicating with her eyes, following people with their eyes, looking towards the items that she wanted. She was already able to reject an undesired item or position or mainly it was things that she didn't want. She already had the communicative intent to show you when she was done with something. And she was able to accept activities or items offered behaviorally. So we kind of are looking at emergent transitional, and she was able to make a comment or label an object. So where to go from here? What we wanted her to be able to do was not just label an object, but maybe describe it, maybe give some type of qualitative or quantitative component, or being able to combine some words together to form a phrase, generating 2+ simple word sentences. So this is kind of the area that we identified that we could work on with her with the eye gaze device. So in my goals and treatment plan, this is where we started. So part of this tool I like is we could see where she was currently and where we wanted her to be, and really have a cohesive tool to keep documenting her progress in. Okay, so last time we used this particular case study when we were talking about our report writing. Mr. John Doe, 25 years old, male with a diagnosis of a traumatic brain injury. So last time we had this little write-up on him, very brief excerpts from the report, and we talked about it being inconsistent when you use words like sometimes. We talked about it being either too little or too much information when we talked or described that he wasn't motivated and throws temper tantrums, and that there was not enough information here when we talk about the speech treatment, just to say that, he had 6 months of treatment and nothing else, just wasn't enough information. And then we talked about here being inconsistent when we're talking about how he can bob his head and move his arms and legs when he's having a fit, but we didn't describe anything else. So to say that he needs eye gaze but has this movement sounds inconsistent. So we were able to correct that, and I've highlighted for you the areas in which we corrected. We took out the sometimes and just simply state it. We talked about what he is motivated to communicate about, food and entertainment. We talked about, yes, he did receive speech therapy for 6 months, but there was no improvement to his functional communication. We talked about, yes, he can move his head bobbing back and forth. His hands and feet do move when he's having a fit, but these aren't volitional movements. He's not moving them with the intent and purpose, or if you just ask him to, he cannot. The wheelchair also was something that was inconsistent. We said that he had a wheelchair. So if you're putting that in the report, but you're also saying eye gaze, you have to explain who's driving that wheelchair, because if the person can drive it, then that means that they could probably drive their eye gaze, their communication device with alternative means, such as a joystick mouse. So you have to talk about, well, who's really driving it. So we corrected that by putting that his mother is driving, using alternative driving control. So anyway, that's just a quick review on this particular young man, and we're going to watch his video and then look at some of his treatment goals.
Back.
Go back.
Fabulous. That was very good. Can you go to I need?
I need.
Awesome. Can you go over to snacks for me?
Go back.
Oh, let's try it again. Let's go to I need. Perfect. Now go to snacks.
Snacks.
Fabulous. What would you like to eat?
Chips.
Chips? You think we should get you some chips?
Okay. So hopefully you all were able to hear the sound in that video. It's a wonder he was such a good eye gaze user with the bobbing of his head. And one thing that I liked about him is he was learning how to navigate with that device, and he was doing really good. At one point he made a mistake, and he was able to correct his mistake before she told him to. She was in the process of telling him, and he'd already performed the action. So it's things like that you definitely want to take notice of when you are documenting, writing your reports, because that can affect your goal. So if he was able to really learn navigation before, during the trial, that might not be a focus area in your treatment plan. So during the trial, we noticed, and he was able to do kind of all these emergent transitional type of goals. He was responsive. He could maintain attention to the partner and to the conversation. And so we might want him to be able to comment appropriately. And this is the social aspect, by the way. So in the other example, we looked at linguistics. Now we're looking at social. So we want him to be able to engage in an activity appropriately, or share some news, tell about his day, or demonstrate conversational turn-taking, and not just be one-sided. We're bringing up all the topics and he's just answering. Demonstrating the ability to continue a conversation is some of the goals in his treatment plan. So now we're going to talk about some of the competency areas that maybe we forget about or not focus on as often, and strategic being one of them. Here, I might be looking, I'm always looking for this emergent level to be happening, especially when it's an eye gaze user. I want them to understand that their use of the device is affecting their communication partner, so that very first goal there in green, in that they recognize their intent, their message was either conveyed or not conveyed. So those two things I'm looking for to definitely happen during the evaluation, during my trial sessions. When it's someone in the very first session that you, or if anyone attended the very first eye gaze webinar that I did a few weeks ago, we talked about having a user of eye gaze who cognitively is maybe a little bit lower skill, and you're kind of starting out with a lot of investigating what they can do on these type of devices. For that person, during the eval and treatment, that might be my goal, to get them to understand that their eyes, that using their eyes, using the device is actually affecting their environment and communication partner. I think we gave the example in one of those sessions. I had a 3-year-old with traumatic brain injury, and so when we put the eye gaze device in front of him and he's able to do a few things on it, that's interacting with the screen. But in order for him to understand that it actually has an effect on his environment, that's something totally different than those programs that have you interacting with just the screen. Those are great, and again, I used a lot of those programs in that webinar as examples. But when you are moving toward treating someone where you have to teach that as a skill, you've got to kind of think outside of the box or back to basics. And I would just have his mother, I would have him call her with the device. So I would have her start in the room with us and turn her back. And so that he would know, when I used this eye gaze device and I called Mom, she turned around. And then we would work on her being further away out of view and then coming back into view when he called her. And then we worked on her being down the hall. And so just slowly teaching him, and it doesn't take long when something immediately is effective in their environment to realize that you're giving them the power to do that. Another thing that I like is this blue section here, this very first one, again, kind of fits in with the example I just gave you. Getting the communication partner's attention is very important skill to have, and with an eye gaze user, I think it's even more important that they have the person's attention. So that may be a skill you have to teach. My treatment plan may focus on some of these other goals, making sure that they repeat their messages when their intended message is misunderstood, or that they have some other mode of communication. For example, sometimes when it's an eye gaze user and they are an adult with ALS and their message is not being misunderstood or there's a problem with their device, you can really tell it by what they're gesturing with their eyes. Maybe it's one eyebrow goes up or something. But making sure they have some method of alerting you, and it may be a facial expression. Continuing on with this section, context dependent, I just starred a few things that I typically look at working on. So for instance, here, this increasing my rate of speech, using some type of strategy is important, especially for your literate eye gaze users, to speed up communication. If they're not able to do that during your evaluation and trial independently on their own, that may be a good goal for you to go ahead and add to their treatment plan, is how can I help them increase the rate of their message and have more than one strategy. So is it abbreviation expansion? Is it word prediction? Is it sentence prediction? to be thinking about those things. And then you have this transitional independent area, and again, alerting people when their intended message was not understood. You know, let me tell you another way, not just repeating the message, but actually finding a new way of saying that particular thing so that they are understood. You know, that sounds like a skill that it sounds like a very simple concept, but it's often a skill that is needed even with literate adults to learn how to do with their device. So I really, again, look to this, and what I do is if there's something that I could tweak within the goal, I certainly tweak it, especially if I can make it fit the eye gaze user better, I'll do that. And these are just examples. So these goals may even give you an idea of something else you want to do that's along the same line. So you can change this in any way that you want to fit the needs of your user. Operational, so a lot of times when we think of goals, especially as speech-language pathologists, we're thinking, well, we want them to be social, we want them to increase their language skills, but we're not really thinking about operational things and I can't say that word, and I'm a speech-language pathologist, strategic competency areas. So with operational, it's kind of hard when you're thinking about an eye gaze user. They're not going to be the ones touching and exploring the device, such as this first goal, this emergent section here. You know, they're not going to be the ones hitting the screen or touching the screen. So how can I adapt that for my eye gaze user? Do you want to use words like exploring, because that's what they'll be doing with their eyes. You want to use words like demonstrating visual attention to the device when you're thinking about your treatment plan. With operational, emergent transitional, I do use this locating their high-frequency words or interest buttons, high-level areas of communication. I'll use that they're able to find all of that, that they're demonstrating early navigational skills. And in that example with the young man with TBI, he definitely met that before the end of the trial because you only had to show him navigation once and then he had it. So with eye gaze users, these last two goals here are definitely things that are very easy to recognize and for them to use on their systems, because a lot of eye gaze users have devices with controls that you're able to allow them to have access to. So they are able to adjust their own volume or alert you if something isn't working right. And if they're not able to independently do that, by the end of your evaluation and trial, then that would be an appropriate goal. Demonstrate ability to turn the system off and on when appropriate. Well, with most eye gaze users, they're not able to turn this system on themselves, but for some devices, you are able to turn it off. So if that is something that's needed for them to learn how to do, it could be an appropriate goal. Operational continuing. So for context dependent, do they demonstrate the ability to charge and care for the device? So that's a very interesting one. A lot of the eye gaze devices out there, the software programs, have ability for the person to monitor their battery or the charge on the device. And so if they can monitor it, then they should be able to communicate to the caregiver to plug it in. And you should be making sure they have a way to ask for that, a way to state that. That's important communication about their device. So operational really can mean not just navigating or understanding their device, but it also can mean the communication about the day-to-day operations of their device. You know, can they talk to you about these things? And of course, my adult users, literate users, I'm doing a lot more of these type of goals than I am with my small children. However, it's something, if they're going to be independent users, eventually everyone will need to be able to communicate about these things. And then this last one here, recognizing that their system might need to be transferred from one environment to another, or one activity to another. You know, that's important. And again, going back to working with folks who have ALS, that could be as simple as, you know, I'm going to be, I want to spend the day in my easy chair instead of in bed, and I want you to move this device for me. So just the simple communicating about these things, or instructions for a new caregiver. And then you have some transitional independent goals and independent goals along the same lines. So navigating seems is mentioned a lot here. Also, being able to troubleshoot and arranging equipment repairs and upgrades. So if you have a literate user and cognitive user, why not be able to, they should be able to communicate about their device with you is the bottom line. And so if they can't, or you recognize that as a need, then definitely add it to your treatment plan. Even this last one is something that I use a lot in households who might need a pronunciation exception. So understanding that, just, you know, do they understand certain features of their own device, and can they communicate about them? So your treatment plan, again, just as a review, it needs to state functional communication goals for the device user. You need to consider all their partners, all their environment, their short and long-term goals, for them to be the most independent user that they can be, and their current level of communication is also included in that. So here's an example of a long-term goal. Client will be able to engage a variety of communication partners in expressing wants, needs, comments, ideas, and questions to direct their care and communicate in all environments, 80% of opportunities, in order to remain in their least restrictive environment. A supporting goal of that long term could be that the client will be able to functionally demonstrate increased rate of communication independently by using word prediction to communicate about a concept that's not pre-programmed into the SGD. The purpose of that short-term goal is a rate enhancement goal, recognizing that not every concept that you want to communicate about will be pre-programmed in, and when someone's using a keyboard to type, that can really slow down the rate of their message. So can this person learn to use some of the features on their device to speed their message up? So that's just one example of what a short-term goal could be. And that sounds more operational, or it could be strategic as well. So therapy plan helpful tips. Consider every aspect when planning your treatment. Documentation is key. So if you're documenting everything that's happening during the trial, during your evaluation, then you're going to have a better treatment plan because you really are keeping your eyes open for what they can do currently and maybe where they need to be going with this device. Limiting vocabulary and adding back later is not always the best strategy with eye gaze users. So remember the example of Emily with Rett syndrome. She, sometimes we get in the habit as therapists, especially if you are a therapist who worked with autism, sometimes we get in the habit of limiting vocabulary and so it's too overwhelming. I'm going to take it all out and only add a few things and keep adding. But know the disorder that you're working with. Research has shown that with Rett syndrome, that is not the best method of working with most girls with Rett. So you don't want to take away their vocabulary. You want to actually leave it there. They can get bored really easily and frustrated. When you limit their vocabulary, it's better for them, research has shown, I guess, to explore. And so that was a hard lesson that we learned with Emily, almost giving up on her eye gaze device because of that, because we were limiting her vocabulary and trying to build it. It just wasn't the best method for her. So when planning out your therapy plan, just kind of keep in mind exactly where they are language-wise, and sometimes the disorder that they have may give you clues to how you want to proceed. Familiarize yourself with the device tools and features. The more you know the tools and features, the better your operational and strategic goals will be. Consider all environments and communication partners when planning your therapy with an eye gaze user. So, in review of the whole series that we did, when you are an evaluator of eye gaze, go ahead and maybe use this checklist. I use it in just about every presentation that I do about eye gaze evaluation. You have to be familiar with all the device and settings that you have access to, and even those that you don't, because you are also providing the education if this device needs to do something and it can't, or what devices can do those things. I'm familiar with the devices that are approved by insurance and those that are not. You need to give families, patients, and clients all of their options. I'm familiar with positioning of all the mounts that you're using during the trial, that you have information either via website or company brochure on the different mounts that you don't have in your facility. Know how to contact tech support for the devices that you're demonstrating during your evaluation trial. Tech support can be your friend because you never know, even the best laid plans, you could have a device that you need to troubleshoot during that time. Know how to troubleshoot during calibration. 90% of the time, if you feel like, well, it didn't work, there's a reason why it's not working, and it could be something that has nothing to do with the person's eyes and everything to do with your ability to calibrate or troubleshoot during calibration, make changes to the way that the device is calibrating or using the tools that are built in. You need to know how to program and edit pages for the device that you're demonstrating and have a camera ready and available to videotape or use some of those programs that we talked about during the first session that actually has a built-in recording feature so that you can record what the person is looking at. And when it comes to report writing, you want to be dynamic, dynamite. So here is some report writing P&T. Be repetitive and descriptive. Rule out other devices and accessories. Make sure your writing is very informative. Check behind yourself to make sure that you're not having anything that is contradictory statements. That includes anything that the doctor sends over. Know the report writing rules of your funding source, and do not forget your treatment plan with your functional communication goals. That's most important. Make sure that your goals are going to be functional for the person to be the most independent user that they can be. And you're only going to get there with great documentation and good observation. I hope you all enjoyed the series today. And I think I had one more question for you. Let's see. I just wanted to know who in attendance were able to attend all 3 parts of the iGaze series webinar. And thank you so much for coming today. And if you were able to attend all 3, thank you for doing that. All right. So we're going to, if there's no questions, then we're going to end the session today. And again, thank you all for joining in.